Hi, I'm here to talk with you about understanding your insurance benefits better. Navigating healthcare insurance can be very difficult at times and overwhelming, and so often we're faced with a lot of questions, including what will be covered, will I have any financial responsibility, how do I know that I'm covered during my hospital stay, and what about when I go home? With that in mind, we want to go over some basic information that you might find helpful. Something to keep in mind first and foremost is that there's two different types of insurance. There's your private sector and your government insurance. You might know the private sector is your commercial health insurance that you may have through your employer or your spouse's employer or another family member. Government insurance is what we know as the Medicare and Medicaid program. And in order to qualify for that, you have to meet certain elements of eligibility. If you have any questions about that, we encourage you to talk to your case manager if you're interested in applying or obtaining more information. And there's also some good websites out there that you might be able to look up. Two that we recommend are medicare.gov and www.mymedicare.com. So to understand a little bit more about your health care coverage, there's no single plan out there that covers all associated costs with your medical plan and care, but some cover more than others. Some people choose to carry more than one health insurance plan, and there are qualifications that determine which insurance then would be primary and therefore hold the right to make determination and coverage of the services that you're receiving. Most often, the secondary insurance, if you have one, is only used in circumstances of covering out-of-pocket expenses. It's best to provide all information as soon as you can to your case manager as early in admission as possible to prevent any lapse in coverage and also to prevent any unnecessary billing to you. To give you an idea of some covered versus uncovered services, covered services include things such as inpatient rehabilitation, outpatient rehabilitation and therapies, your co-payments, co-insurance, and deductibles. And then as far as limitations there are often on devices, drugs, services, and access to specialties and specialists. Coverage limitations, benefit limits. So many insurance plans limit the coverage of services by limiting the total number of days allocated to your rehab stay and skilled nursing care. It's extremely important to become aware of those limitations as early as you can if they're applicable to you. If your loved one's inpatient rehab stay exceeds the number of days that your insurance carrier covers, the patient would then become liable for any additional time. In that circumstance, most patients apply for medical assistance if they don't already have a secondary insurance, and that often will allow for continued coverage of inpatient services and or coverage of the following after discharge based on medical necessity. How to obtain information about that, whether you have a benefit limitation, it's often recommended that you contact your employer or HR department for the information that was provided to you when you purchased the plan. Directly from your insurance company, you can also call them and speak to member services and inquire about if there's any limitations and what your coverage actually is within your plan. You also want to refer to your policy in advance in case you're suddenly faced with an issue or disagreement with their coverage of a requested service. Medically necessary services is often a phrase that you'll hear. If your benefit states that it has unlimited days of coverage, this is based on the determination of medical necessity. So that means that your insurance will determine by review of a medical director whether the service in their medical opinion is necessary and cannot be provided in an alternative or more cost-effective setting, such as a skilled nursing facility if you're inpatient here, or home or outpatient clinic. In that circumstance, clinical information is submitted at the request of your insurance company throughout the admission to request continued services, usually on a week-to-week basis. What happens if my insurance denies covering medically necessary services? So on occasion, there are adverse decisions made by your coverage, continuation of your stay, and in that circumstance, our clinical team will be advising you along the process of your rehab, always taking your insurance benefits into account so that they can be maximized and your cost minimized. As part of your team, your case manager as well as a utilization review representative will manage communications with the insurance company to demonstrate your care needs. If your insurance still denies extension, you'll be alerted by your case manager, and your physician, if they are in disagreement with the determination of the insurance company, will begin the appeal process on your behalf and alert you along the entire process. So how is discharge date then determined? Your discharge date is solely determined on the continued appropriateness for inpatient acute rehab. On admission and throughout your stay, your clinical team continues to make recommendations throughout your treatment and regarding your prognosis and path of treatment. These recommendations are based on progress towards your functional goals and need for active medical oversight, warranting continued hospitalization. That's what we refer to as medical necessity. Many factors of your case are determine the discharge date. These include your medication regimen, functional status, your goals, your continued progress, your need for caregiver training, equipment procurement, and time required for post-discharge setup of services, and many other factors. But what happens after discharge? Does my therapy end when I leave here? So rehabilitation continues for most patients following discharge. It will take time and various levels of therapy to heal and set new goals, and that is why there are many levels of therapy to serve your needs, what we refer to as a continuum of care. In the information packet, we included a brief summary of the various levels of care in the continuum, and please be sure to discuss these further with your case manager, especially if you have any questions. They'll be able to help you guide through the options and recommendations from your clinical team. And also, similar to inpatient rehab, there are criteria that must be met for admission to those various levels of care. The information provided will also help further define for you and direct you on each step of the way.